Well, we promote healthy eating, which means lobbying Congress. It means sometimes litigating against fast food chains. But the core of it is clinical research, where we actually bring people in, change their diets, and see how they do. As a doctor, I've really come to the conclusion that the diet that Americans ought to be following is exactly about the opposite of the diet I was raised on. I grew up in Fargo, North Dakota, and it was roast beef, baked potatoes, and corn every day, except for special occasions when it was roast beef, baked potatoes, and peas. And we've now learned that the populations that don't eat meat at all are actually the healthiest. And people who focus on vegetables, fruits, whole grains, beans, those are really the foods that support health the most. And the closer you get to that kind of diet, the better off you're going to be. When we look at people who might resist this kind of prescription, part of it is industry, of course, which makes a lot of money off of selling all kinds of unhealthy things. Another part is government, I'm sorry to say, because the industries that profit from sales don't want to be regulated. They want to be in schools, they want to be in food assistance programs, and they lobby very hard. But of course, the biggest issue is for everybody, if you grew up in a certain way of eating, it takes a little bit of time to get used to a new way of eating. Not a lot, but a couple of weeks, and for many people, they've never been even a week on the diet that their body was really designed for. When we look at the changes that have been occurring in recent decades, I'm seeing two trends. The first is that the number of people who are waking up to healthy diets is bigger than it's ever been. You just have to walk into a health food store. 20 years ago, it was a little dark place playing folk music, and the cashier was named Sunshine, and the products were really not that good, and there weren't any vegetarian cookbooks there, or maybe one or two. Well, today, you go into the health food store, and they have got, first of all, shelf after shelf of terrific books, all totally plant-based. They've got every product to replace bacon and sausage and burgers and milk. They've got 50 kinds of soy yogurts, and there are so many products, and there are people buying them. The other trend, though, has me worried, and that's that despite the fact that there are more people aware than ever before, and including a lot more doctors, the number of people who are still dealing with health problems, with diabetes, with very serious health issues, is bigger than it's ever been. So I really think that we've got to continue to get this word out, and we've got to try harder than we ever have. If you look at medical practitioners, the pressure to prescribe is stronger now than it was when I finished residency. And the pressure on the continuing education that doctors get, it's just, the nutrition message is lost in an avalanche of drug profits. And I don't see a way out of that except for doctors who know better to continue to get the word out. And of course, when their patients then follow a plant-based, health-supporting diet, and then they impress the heck out of their doctors, that way we can win. So many people have more than one problem. They're gaining weight. Their cholesterol comes up, and their blood pressure comes up, and sooner or later, a lot of them end up with diabetes, and in their later years, some of them start having cognitive problems. I'm talking about Alzheimer's disease. And these things tend to cluster, and all of them actually respond to diet changes. Many people don't realize that. They think, I've got a high cholesterol, I need a cholesterol-lowering drug. I've got blood pressure, I need a blood pressure-lowering drug. I've got diabetes, that's genetic, so I need some injections for that. Well, we may need medicines for these things, but all of them have their roots in diet, and they all have their roots in the same kind of meaty, fatty diet. The meat and the dairy industries, I think, have really responded to the health message by redoubling their efforts, not to improve their products, but to improve their lobbying. And they work harder than ever to make sure that Congress spares the subsidies for them, that it keeps their products in schools and that kind of thing. That's got to change. One change that I'm really excited about is the number of real political giants, entertainment figures, who are all embracing a healthy diet. And 20 years ago, it was philosophers who were doing a vegan diet or something like that. Well, today, we've got President Clinton, and you have people like Ellen DeGeneres. And, you know, the people who are most in the public eye are saying, not only am I doing it, I'm profiting from it, I'm losing weight, I'm feeling better, and I also really like it. Nobody ever says, gee, you know, it's great to have lost this weight, but man, give me my old pork chop. People don't do that. They are so past that. And they're letting the rest of the country know that they really are setting that aside, and this is the new way. And I'll tell you, it's going to make my job as a physician a whole lot easier because people know about it and they want to try it. There are so many things that people can do to help. First of all, we need to get our own diets in order. And for many people, that requires a little bit of effort, but they can do it. And that has a great effect on everybody around them, their kids, their family members, their friends, their doctor. But also, it's really important for people to not be just complacent. They need to call their members of Congress and say, is our national policy in line with health? We're sure spending a lot of money on health care. Are we also spending money for unhealthy foods that's really going to undercut our efforts? So members of Congress right now, if they're hearing from organized agribusiness lobbies, they need to hear from teachers and doctors and nurses and everybody who's concerned about the health of this country. Right now at PCRM, we're continuing to launch a number of studies. Some of these are what I'm going to call really basic studies to just see the extent to which diet might affect one or another aspect of health. But some of them are what I'm going to call applied studies. We just tested out how in a doctor's office can you introduce a plant-based diet at little or no cost to the medical practice. How can businesses do this? We've been working with Geico, the car insurance company, and we just completed a study at 10 different Geico sites. We're also on Capitol Hill, and we're there every day. And we're talking to the senators and the members of Congress to say we've got to stop subsidies for unhealthy foods. And there are a number of times where we sue the bastards. I have to say we drag the fast food chains into court. Legally, they can sell whatever they want to. But there are some laws about what they tell the consumer if they're going to be honest about what's in that food. And that's where we've got to hit them. I think the most important thing that I am trying to get across when I talk to people one-on-one or when I talk to larger groups is, first of all, you really can change. So many people think, it's too late for me. I'm too heavy. Or I've had diabetes now for 8, 9 years. I can't make any changes. Wait a minute, it is never too late to make big changes, and it is shocking for people to see how much power they still have. The other thing, though, is there are so many people who are kind of procrastinating. I'll get to it all in good time. If we had changed our diet 10 years ago, we would be a whole lot healthier now. So that's my message. You can do it. The payoff is enormous. Let's start now.